Welcome to this instructional video to kick off Chapter 12. Wow, Chapter 12 is a beast. There's so many topics in Chapter 12. Well, Chapter 12 is about biosignaling, which really we know to be signal transduction. There are a lot of important biological signals that basically modulate activity within a cell. And so we're going to talk about, since Chapter 12 is so big, we're just going to talk about some specific systems. And it's not going to shock you when I say one of the most important systems we're going to talk about in Chapter 12 are G protein coupled receptors. We already know about them. We're going to review how they work a little bit in class. But in 530, we talked about beta adrenergic receptors that responded to epinephrine. And we also talked about the glucagon receptor. Both of those work through G protein coupled receptors. And we're also going to learn in class that there's many, did I mention, many other important biological signals work through G protein coupled receptors. There's also a different type of receptor system called a receptor enzyme, and probably the best example of this is the insulin receptor. Yes, insulin binds its receptor on the outside of a cell, but that activates enzyme activity within the cell, and it activates tyrosine kinase activity. And that's just a prelude to the signaling cascade that happens after insulin binds its receptor. So we're going to talk about specifically the insulin receptor. Gated ion channels, while they're important, we're probably not going to spend too much time on that, nor are we going to talk much about nuclear receptors. But before we get into some specific systems, I want to spend some time talking about overall or general features of signal transducing systems. So here, get in your mind that we have a receptor, and that receptor is probably an integral membrane protein, and then molecules bind to the receptor, and they are called signaling molecules. Again, we're being very generic and just over kind of big picture right now. So signal molecules bind to receptors, and then a transduction of that signal occurs within the cell. There's just some common themes that apply to these signal transducing systems that I want to just kind of get out right now, and then we're going to give specific examples of most of these as we move along. The first example is specificity. Don't you think receptors need to be specific in terms of what it can and cannot bind? Imagine a world where other molecules besides insulin could bind the insulin receptor and initiate the same cascade events within the cell. That's not good. The insulin receptor needs to be specific for insulin. So specificity is a very important issue. Now, I've thrown around the word selectivity already in class. Let me give you an example here on the right of what I mean between the difference of a selective receptor versus a specific receptor. So let's say we have a selective receptor, and it can bind two signal molecules, S1 and S2. Look at the binding constants. The binding constant, Kd, of S1 with our selective receptor is 10 to the minus 4th molar, and S2 has a binding constant of 10 to the minus 3rd molar. Probably, there's only one order of magnitude difference in the binding constant. It may be that this selective receptor could bind both of these, bind both of these signal molecules, and both of them be physiologically relevant. Again, that's I think it's the exception and not the rule. That's could be dangerous just because of what I said before with insulin. We really want these receptors, for the most part, to be specific. Okay? Specific. And let me tell you what I mean by that. So let's say we have a specific receptor that can bind signal molecule S3 and signal molecule S4. The binding of S3 is 10 to the minus 10th molar. Wow, that is tight binding. That's very tight binding. And then S4 combined with a binding constant of 10 to the minus 2nd molar. That's weak binding. Ladies and gentlemen, it may be true that the specific receptor can bind S4, but it's not physiologically relevant. So we're going to call this receptor specific for S3 because it really has one endogenous signal molecule it's going to bind tightly. I hope that kind of gives us a difference between selective and specific. Real quick, what are some other things about signal transducing systems we're going to encounter? The second one is amplification. Don't we want to be able to amplify the signal? Because one signal molecule binding to one receptor molecule, that's great, but that's going to be difficult to impact significantly what happens in the cell if we just have one signaling molecule binding one receptor and then that doing one thing. So we have ways of amplifying the signal, and we're going to go into how that can happen. There's something called modularity we may touch on a little bit. An important one is going to be desensitization adaptation. So within a cell, when a signal is sent, there's got to be some consideration of turning off the signal. Do you always want to be hitting the receptor with the signal? No, we've got to be able to turn off the signal, either by degrading the signal molecule or basically doing something to the receptor that's going to make it less available or less willing to bind the signal. That's part of this whole process as well. Do we need to send signals? Yes. Do we need to dampen the response? Yes. All right. Another important aspect of these systems is integration. Think about your own life. You may have 2 or 3, maybe more people telling you what you should be doing. You have signal molecules in your life. You should be doing this. Well, why aren't you doing this? Well, I think this should be happening. And so you are always getting multiple inputs. Same thing with the cell. You have multiple receptors on the outside of a cell membrane, and different signal molecules may be binding to those receptors, and they may be sending opposite signals. So really, a cell is getting multiple inputs, and it has to basically be able to deal with what we call an integrated response. Just like you have to do in your life. Your life is an integrated response. You're getting a lot of information in, a lot of signals sent, then you actually have to do something with those. Well, same thing with the cell. Integrated input. And then another one's going to be localized response. Yes, a signal is sent to a cell, but sometimes the response needs to be localized within the cell. And that's a special situation that has to be dealt with in kind of a specific way. This is a harder issue to deal with because you only want a localized response. You want a signal to send a localized response. How is that possible? We're going to talk about how this can go down in a few specific instances. All right. Again, big picture. We're in the world of the receptor now. Receptors, although receptors can be connected to enzymes, not all receptors typically are not enzymes. All right, so the insulin receptor is a receptor, but it's also tied to an enzyme inside the cell. But let's just talk about the receptor part. That's an integral membrane protein and what can happen to this receptor. We've got to learn the language. And the language is something called an orthosteric and allosteric binding sites. Ladies and gentlemen, the orthosteric site in a receptor, and so you can kind of look at our image here. Here's our receptor, and there's multiple binding sites. There's 2 binding sites shown. The orthosteric site is where the normal ligand binds. So every receptor typically has a normal or endogenous or primary ligand that it binds to, or that binds to the receptor. So we have this ligand binding the receptor. That's called the orthosteric site. Now, what we can have, let's just talk about the orthosteric site now. We can have what's called a competitive antagonist. This is analogous to a competitive inhibitor in an enzyme. A competitive inhibitor with an enzyme competes for the active site. Ladies and gentlemen, in the world of the receptor, competitive antagonists compete against the normal ligand for the orthosteric site. So this is competition at the orthosteric site. Now, what do you think that's going to happen? Well, the normal ligand binds the orthosteric site, and then you have a response to that. That's called signal transduction. Well, competitive antagonists typically, let's say it this way, dampen the response. If there's fewer ligands binding to the orthosteric site, which there will be with a competitive antagonist around, you're going to have fewer signals sent. The response is dampened. All right? Now, that was the orthosteric site. This is where the business happens. This is analogous to our active site at enzymes, but we're not talking about enzymes, we're talking about receptors. Okay? There's also an allosteric site, and we saw this a lot in 530. We had allosteric modulators of enzyme action. Well, we can have allosteric modulators of receptor action. Okay? So, this definition is not going to surprise you. The allosteric site is distant. Let's don't call it distant. It may not be far away. Let's just say away from the orthosteric site, but can impact orthosteric site So this is again completely analogous to what we have with an enzyme. We have an allosteric site. It's away. It may not be that far away, but it's away from the orthosteric site. Molecules can bind in there, but they can impact the orthosteric site and or the response. Okay, let's go into greater detail about this, because there's two types of allosteric modulation when we talk about receptors. Okay, so both of these right here are allosteric. There's something called an affinity modulator. That's a molecule that can bind in the allosteric site and really control the binding constant of the normal ligand in the orthosteric site. And so really what we see here is an affinity modulator. It's an allosteric issue. Okay, it's an allosteric binder that modulates the affinity of the normal ligand for the orthosteric site. So basically you can increase or decrease the binding constant of the normal, or sometimes we may call this orthosteric ligand. And again, this is not that different than kind of what we've talked about with enzymes. We had some examples of that. So that's one way that we can modulate that's one way we can modulate a receptor, is allosteric site affinity modulator. But what is an efficacy modulator? An efficacy modulator binds to an allosteric site. It does not change the binding affinity of the orthosteric ligand at all, but it does modulate the response of the receptor. Okay, so how are we going to say this? So it does not impact binding in the orthosteric site. It does not change the binding constant of the normal or orthosteric ligand in the orthosteric site at all. It does not impact that at all, but it does modulate the response. And what I mean by the response, that it can modulate, what happens after the orthosteric ligand binds to the orthosteric site. The binding is the same, but the response is different. Okay? Again, this may be kind of hard to kind of wrap your head around a little bit, but we will see some examples of this. So we have the orthosteric site, the allosteric site, and within allosteric modulation we have affinity and efficacy. Affinity is an allosteric modulator binding in a site away from the orthosteric site and either increasing or decreasing the KD of the normal ligand in the orthosteric site. The efficacy modulator does not in any way, shape, form, or fashion change the binding of the efficacy modulator binds at a site away from the orthosteric site. It does not impact binding of the normal ligand in the orthosteric site, but it does modulate the response after the normal ligand binds to the orthosteric site. Again, big picture, we'll see some examples of this. I do want to mention the term bitopic ligands. This is a big thing in drug design now. If you want to shut down a receptor, can we design a molecule that binds in both the orthosteric site and allosteric site at the same time? So the molecule has features such that it can bind in both sites. So it has to be a pretty big molecule probably, or a fairly large molecule for this to work. So bitopic binds to orthosteric plus allosteric. So let me give you just one example as a kind of a parting shot at the beginning of these notes, and it's the Gaba receptor. Wow, what an important receptor. The Gaba receptor responds to the neurotransmitter gamma amino butyric acid, and it's involved in many things. You may have talked about this neurotransmitter and this receptor in animal physiology. I'm not sure. Just for full disclosure, there's two types of GABA receptors. There's GABA A over here on the right. I've written it down for you. GABA A, which is a ligand-gated ion channel. It's a chloride ion channel. And GABA B. And GABA B is a G protein coupled receptor. Well, what I want to talk about very briefly here is GABA A. Again, this chloride this chloride ion channel. So look at this cartoon. And what I want you to notice is either at extracellular binding sites or transmembrane binding sites, look at all the molecules that bind to the GABA A receptor. Wow. Okay, one that you should notice first is GABA, because it binds in the orthosteric site. So GABA is the orthosteric ligand, if you want to say that. The normal ligand. I don't want to cover up GABA here. And then there's a lot of different allosteric modulators. Look at this. Ethanol has a high affinity binding site it's an extracellular binding site on GABA. Benzodiazepines, barbiturates. Look over here on the right now in the blue. These are transmembrane binding sites. Barbiturates, quaaludes. This is how anesthetics work. They bind to the GABA A receptor and modulate chloride ion flow. That has to do with anesthesia. And there's a low affinity ethanol binding site. So again, this is my kind of big picture for you to say, here are receptors. Sometimes we get many ligands that can bind to the receptor. There's an orthosteric site, an orthosteric ligand, the normal ligand. Okay? And then we have all these other sites where other molecules can bind away from the orthosteric site. Those would be the allosteric modulators. And let me just give you one example of the ones that I've mentioned. Benzodiazepines, what are they used for? Well, they are sedatives. They are used as muscle relaxants, a muscle relaxant. Well, that's their kind of pharmacology, but what do they do? Well, benzodiazepines binds to the to an extracellular binding site away from the orthosteric site. Therefore, it is allosteric. Benzodiazepine is allosteric. And it enhances the effects of gamma amino butyric acid. So, let me add this to the notes. So, benzodiazepines, sedatives, a sedative, muscle relaxant, and it enhances effect of gamma amino butyric acid. So it binds in the allosteric site, and what does it do to the binding constant of GABA to its receptor? Lowers the KD of GABA. Ladies and gentlemen, we would call this an affinity modulator. And in fact, we would call this a positive affinity modulator. So, I don't want to spend a lot of time on the GABA receptor. It's very much important. But this is just our model for what's an orthosteric site. What are allosteric sites? And you can see from the GABA receptor, some of these receptors have many allosteric sites in different places that can really impact the biological activity of the receptor. So I guess this image in the top right just shows us that, you know, allosteric sites and orthosteric sites can be pliable a little bit. Binding in the allosteric site can change the orthosteric site. So that's how we can do this affinity modulation. And so we're going to see many examples of this as we move forward in terms of signal transduction. So I think I'm going to stop it here. I've talked too much, but I want to give you an introduction to signal transduction and then some of the terminology we're going to be using throughout this chapter. Thank you.